This segment of Delmarva Life is brought to you by Tidal Health.
We might be inching closer to the end of Breast Cancer Awareness Month, but we want to keep the conversation going. Highlighting services that can support strong breast health is vital to saving lives. And we'd like to introduce you to Dr. Karen Barbosa, a breast surgeon with Tidal Health. Thank you for joining us this afternoon.
Thank you for having me.
So let's start off. Studies show, and I want to read this, make sure I get it right. Studies show about 13% of women will develop invasive breast cancer. So with that in mind, at what age do we start getting the vital mammograms?
So I'm going to cite my society, the American Society of Breast Surgeons and the American College of Radiologists, as long as the Society of Breast Imaging. They all say start at the age of 40 and do annual mammogram screening if you're average risk. So then the next question is, what's not average risk? Well, high risk are people with higher family histories of breast cancer or what we call genetic mutations. We usually recommend that women start getting screening if they don't know what their risk is 10 years before the first member of their family was diagnosed.
Oh, okay. So for those who maybe have not had one yet, how is a mammogram performed?
So mammogram is basically an x-ray, and we do it in the cranial caudal. They squash you down from top to bottom, and then they do it on the medial lateral oblique, which is on an angle, and we have to see something in two views for it to be real.
So, and it's really not painful. I mean,
it's a bit of compression. The more compression we get, the more we can see through it. So it's a little uncomfortable for some people. Other people have no problems at all. Sure. It really depends on the person.
Sure. Okay. So during the pandemic, a lot of people skipped screenings. We couldn't get them for a while.
Yep.
It's important for us to get back and make up for those.
Absolutely.
Isn't it?
Absolutely. Early detection and diagnosis is the key to saving lives. And what I'll say is that every institution across the U.S. has instituted safety policies, wiping down everything, social distancing. We have tried to make it safe for everyone, everywhere. And this is not just at one program. This is a nationally recognized safety program that is made available so that becoming aware of what your risk is by getting your mammogram is not going to be scary or dangerous.
Now, you touched on risk factors as far as genetics. Is there any other risk factors that we need to be aware of?
So being a woman is a risk factor. Getting older is a risk factor, but the alternative to getting older is not getting older, which is not good, right?
Yeah.
So we usually will say looking for family clusters. We can also talk about, exposure to chemicals, exposure to radiation, exposure to environmental things, actually getting less sleep at night because of well-lit environments, or nurses who are on night shift.
Breast cancer is not the only thing that you treat, right?
Yeah. So I decided that I would call myself the doctor of the breasts.
Yeah.
I'm like your family practitioner, but I deal with everything breast. So I deal with a lot of breast pain. A lot of times patients have questions or issues other than cancer. And once again, looking at risk. So that's becoming a whole world of its own environmental subset in medicine. When we look at risk, it's identifying people who are at high risk. There are women who think they're high risk and they're not, and there are people who don't know that they're risk at all, and they are. And that looks at when they had their children, when they started having their menses, breastfeeding. All of these things can calculate into what a woman's actual risk is. So then comes genetics from the topic of risk. If you're high risk, you probably should have genetic testing. With genetic testing, we look at people with changes in their DNA who are going to be at even higher risk.
And Tidal Health has a multidisciplinary approach to treating breast cancer?
I think most centers are offering a multidisciplinary. No longer is the surgeon in a silo doing what they do and then saying, okay, good luck, go find the rest of your team. Now most breast cancer centers are really focused with integrating your care with other providers. So talking to the medical oncologist, talking to the radiation oncologist, talking to the radiologist. Before I even go to surgery, I talk to the radiologist. We look at the cases together. We make sure that we're identifying the right area.
So you're relatively new to Tidal Health. So let us know what drew you to the area.
Well, actually, it's kind of sad. My mom had a stroke, and I came back to the East Coast to be closer to her. And my fiance is a retired Air Force veteran who said, no New York, no Boston, no Chicago, because usually people like myself would go to major cities, and I often get from my patients, what are you doing out here? But I came out here, and I love it, and I think there's a really special community out here, and I feel excited to be able to bring new concepts, new technology, new research, new everything, you know, to revitalizing the system out here and really getting the community jazzed. That's my evil plan by talking to you, is getting the community to realize that I work at a hospital, but I work for the community. And really it's about getting education out so people know what to ask for.
Dr. Karen Barbosa with Tidal Health. We are so fortunate to have you. Thank you so much.
Thanks for having me.